So pharmacists oftentimes get handed some prescriptions that really make you wonder. This one was super confusing, and I'll let you pause the video and see if you can figure out what it is. The handwriting certainly doesn't help. First on the list is azithromycin 500 milligrams once daily on Monday to Friday. This is a macrolide antibiotic and generally used to treat intracellular infections. Second, we have rifampicin 300 milligrams once daily. Handwriting isn't great here. Maybe with the first two you can figure out what it is, but this is a super strong antibiotic. Would generally give it out for, say, tuberculosis, again for intracellular infections. It's an enzyme inducer, so it will interact with a lot of other medications. So before you take this, we would have to check your medical history to make sure you're not taking anything else that would interact. So third on the list is Malarone, 2 tablets once daily. This one really threw me off guard because this would be taken before you go to a malarious country. If anyone's ever traveled, you probably will have taken this. It can also be repurposed for its use on parasitic infections. So this could be a hint for you if you haven't gotten what the prescription is for yet. Fluconazole, this is an antifungal and would generally be taken for people who would be on antibiotics to prevent against a fungal infection. I would also give it out for things like thrush. And the last one there is low dose naltrexone. This is a super interesting drug and it would be used, say, to reduce inflammation in the immune system. I'd give it out for autoimmune conditions usually. So you might have a fair idea now, but I couldn't find out who the doctor was because he didn't have his name printed and that's his signature at the very bottom. So I had to ring the patient and say, look, who is your consultant in this Dublin hospital? So the patient informed me that he was with a professor of infectious diseases. So I copped straight away. This is for Lyme's disease, which is a pretty nasty tick-borne illness and it can be super severe in the worst cases. So the patient didn't know what to take here for the supplement and probiotic. I read this differently in the beginning, I will admit. So for the supplements, I recommended a good vitamin D3 with a vitamin K2 as well, because this can help with immune function and also with bone strength. Secondly, I recommended magnesium because this can help with muscle function, but also nervous system regulation, which is something that is really badly affected with patients with Lyme disease. I recommended omega-3 fatty acids because this has a great benefit for reducing inflammation in the body. And in terms of probiotic, I recommended a good probiotic that had Lactobacillus rhamnosus and Bifidobacterium lactis because this has really good effects for people who need to restore gut health, particularly when they're taking antibiotics for prolonged periods of time. And this patient had a 3-month script, as you can see there. So yeah, that's just an insight into what some pharmacists can deal with on a daily basis. It's not all so easy all the time. And yeah, this one was an interesting one that I hadn't seen before. So yeah, let me know if you enjoyed this and if you want to see more of this type of content.